Welcome once again to Doc Talk. I'm your host, Dr. Matt Bynum, and today I have with me Dr. Kim Mowery. Kimberly, welcome.
Thank you. Glad to be here.
It's great to have you here.
Thank you.
You know, as we get into this, we interview and talk with dental professionals and other healthcare professionals around the world, and it's really a pleasure to have you here because you bring something to the table different than most of the gentlemen that I speak with. You're female. Tell me what it's like to be a dentist, a female dentist practicing today.
Well, I love being a dentist, whether it be female or male. I think it affords people the opportunity that, you know, especially some patients that we have that may not want to have a male doctor for any particular reason. So I think it's nice for some people to have that option to go see a female dentist. Perhaps we have more of the reputation of being gentler and we have that stigma, but
Sure.
And I do believe I am gentle, and I've had all of my patients tell me that. So I think that's maybe why it's actually a good thing to be a female doctor, dentist, because people do perceive that we are gentler.
A little bit better care,
Yes.
more gentle.
More,
you know, I agree with you.
Yes.
A little bit more caring. It's that motherly instinct
Yes.
of that nature. So as you bring that to the table, obviously you have a family.
I do. I do.
Tell me a little bit about your family.
Well, I am very blessed. I have a marvelous family. I'm very privileged that my husband is also a dentist, and we have practiced together before. Mentioning kids, I do have 2 children. I have a daughter that's 9 and a son that's 6, and they are really enjoying just more of the outdoor life. Gainesville is an absolute wonderful place to live.
Right.
Beautiful city.
This may be a little bit embarrassing, but you know, you and I have known each other for a long time, and I have to say that of all the individuals that I've met in the profession, you're very quality conscious, and you pay particular detail and particular attention and detail to the level of quality you're serving with your patients. You were affiliated with the university as a professor or helping to teach?
Right, that is correct, in the prosthodontic department, and we do like to go in and help the students there as well, and to try and teach them some of the things that we know, you know, that you may not learn in dental school. Dental school is for the foundation, that's what you're learning, but you have to continue your education once you do get out of school. Continuing education is very important, and your philosophy. There are so many different philosophies of dentistry, and you have to find what you're comfortable and what your philosophy is. And my philosophy is I am very detailed oriented, and I don't know if that's a female thing, but I am, in everything I do, I am very, very conscious of details. So I would totally agree with you on that.
And I know that about you. The level that you bring to the care, but your friendships and your family is I can't say that it's unique, because I do think there's a motherly aspect to that, but it's very genuine. And
Well, thank
I
you.
think the people that you're going to be serving are going to be very fortunate, very lucky, because I think your level of expertise that you bring to the equation is phenomenal. And let's talk a little bit about the procedures that you do. Obviously, you do dentistry and you do smiles and things of that nature, cosmetics. Tell me more about that.
Well, we do that. You know, we do, like I said, we concentrate on providing care, quality care, individual, personalized care. That is our main concern. We don't have, you know, 15, 20, 30, 100 patients coming through our practice every day. We're very into personalized care. When you're in my office, you have my attention. I'm not running in and running out of the operatory. I am there to see you because I'm concerned with what you're there for. You have my full attention. And that's what I like, because I can go to the physician's office and I'm put in a room, I'm kind of left there until they come knocking at the door, and then, you know, I see them for maybe 15 minutes, and if I'm lucky, to go over whatever the problem may be, and then they're gone. And that's just how medicine has morphed and what it has morphed into. I am not tied to how medicine is. I'm very fortunate in the practice that I have chosen, dentistry, where I can take my time with my patients. I can be concerned with my patients. My patients are my friends. I really enjoy building relationships and having that rapport with my patients. So I think we're very, very fortunate in that aspect of what we do.
So comprehensive, personalized care
Yes.
sounds very different from the way most dentists would handle their patients in their practice. And it sounds like you're bringing a very unique approach to helping individuals through what you mentioned as neuromuscular dentistry.
Right.
Go into a little bit more detail for that, for me and for the people watching.
Neuromuscular dentistry is a philosophy of dentistry, and it's coming more to the forefront of how not only dentists are thinking, but you're pulling in ENTs, you're pulling in physicians. People are starting to understand that the jaw has a lot more to do with the rest of the body, the health of the body. So we kind of look at the body overall. We're not a one-tooth doctor. We're not going tooth by tooth. And yes, we can treat one tooth in our practice. I'm not saying that. But we're looking at the overall health of the patient. And that's what neuromuscular dentistry really is. It's getting the jaw and the body back into health. So it's a very exciting philosophy of dentistry. It is to me. It is not everybody's philosophy of dentistry. And I think that with that, we see so many people that are in pain or they've suffered for so long with jaw issues, back issues, neck issues. All of these things are related. It all comes and starts in our head where our jaw is. Sure. And it's just an amazing thing to be able to help these people, and they understand that we can help them. And it's kind of a frustration for them, I think, in the beginning, because they come in and we kind of talk to them about this may be what's causing their issue. And they're like, why has nobody ever told me this? Why has my physician not told me? Why has my ENT? You don't know what you don't know. And this is something that's coming around, and people are starting to embrace it and accept it. So it's a very, very exciting part of dentistry.
I mean, it sounds exciting. There's because you're really providing care at a level that most people would probably never think to provide.
Right. And it's not setting ourselves out different. There are, like I said, there are many different philosophies of dentistry. This is the philosophy I choose. I choose to help my patients wholeheartedly, the full spectrum of what is going on. I don't want to race in and race out. I'm there to help them to be the best that they can be and to help them get better.
Wow. You know, I know that in talking with you previously as well, that besides neuromuscular approach and comprehensive approach to providing care for patients, you also offer a different line that extends beyond the traditional aesthetics of just aesthetic dentistry. Tell me a little bit about that. You're offering avenues for Botox and different avenues to provide aesthetic facial aesthetics? That's amazing. Tell me some of that.
I'm glad you brought that up, because we do forget, as when we're discussing dentistry, you always think teeth, and we do kind of look at, like I said, we're looking at the whole picture. We're looking comprehensively. And when somebody does come in and they would like a beautiful smile, let's say we're redoing their teeth and giving them this big, beautiful, natural smile that they've always wanted, and they want to take, which does help take years off of your life, because having a beautiful white smile, it really does change the way you look. But also, you know, some people are interested in having fillers, you know, having fuller lips, or, you know, people, as we start to age, our lips we get a little more wrinkling around our lips, or, you know, just, you know, we start to get some lines around around the mouth, or we're getting crow's feet, you know, women, you know, we start to notice these things, and it makes us feel like we're aging. So we do offer that in our practice, and it's very exciting to be able to do it. And one thing that is nice for us, and our patients enjoy, if people have ever had fillers done, it can be uncomfortable, and we are able as dentists to numb the patient up, and that is a very big benefit to people, because you're comfortable during the whole procedure. We're able to sculpt, if you would, exactly how, if we're working on the lips should be, and we're sculpting it and making sure it's even, and because you're numb, you're not feeling everything, so we can do what we need to do, and you're comfortable, and it's exciting. I mean, it's really a neat adjunct to being able to provide.
To just teeth.
Oh, it's awesome. It's really cool.
It makes sense. I mean, as a dentist, you are a physician of the head and neck.
Right.
and this is the region.